Hi, Miss Kennedy. I'm Crystal. I'm going to be your nurse today. We're going to be doing a physical assessment. It's going to take us about 20 minutes. We'll go ahead and get started. I'm going to wash my hands for your safety to help prevent the spread of infection and shut this door for your privacy. I have a few questions for us to get started. First is, can you tell me your full name?
Sierra Kennedy,
And can you tell me what today is?
Monday, October 3rd, 2016.
Perfect. And can you tell me where you're at?
Conway, Arkansas.
All right, that's perfect. Let's get started. We're going to start at the top with your head and we're going to work down to your toes. Okay, normal cephalic. Scalp is dry, no lesions. Her hair is coarse and blonde, straight. The face has normal skin. There's no lesions on her face. Her eyes are symmetrical. Nose and mouth are midline. Okay, Miss Kenny, we're gonna go ahead and test your trigeminal nerve, which I'm gonna have you close your eyes. I'm gonna test or touch your face in a few places. I just want you to let me know where I'm touching. Okay, here we go.
Left temple, right cheek, left chin, right chin, right temple, left cheek.
Okay, perfect. And I'm gonna go ahead and have you clench your jaw. Okay, good. The submandibular joint is intact. And I'm gonna have you smile for me. Okay, your smile is symmetrical. There's no facial drooping, so your facial nerve number 7 is intact. All right, I'm gonna have you close your eyes. I'm gonna try to open them. I just want you to resist me trying to open them. Okay, good deal. All right, gonna go next. I'm gonna look at your fingernails. Your fingernails are clean, they're trimmed, they're translucent, there's no clubbing. That's good. Okay, next we're gonna go to your eyes. We're gonna look at your eyelashes. Eyelashes are evenly distributed, they're everted, and eyebrows are present, they're symmetrical. There's no scaliness, no dryness, they look good. Optic nerve test is we're gonna have you cover one eye. We're gonna start with your left eye, and we're gonna look at this chart over here, and I want you to read to the lowest level, read the last line that you can see without any problems.
DEFPOTEC.
Okay? And I forgot to ask you, do you have any contacts or glasses in?
No.
Okay. And we're gonna cover your other eye, and we're gonna go ahead and do this again, the lowest line that you can see without problems.
DEFPOTEC.
Okay, and I'm gonna have you take it off and read with both eyes open.
DEFPOTEC.
Okay, perfect. And then I'm gonna hand you this paper here, and I want you to let me know what colors do you see on this paper here?
Green, black, and red.
All right. And the next one, we're gonna test 3 different nerves with this one. It's the oculomotor, the trochlear, and the abducens. And I'm gonna draw an H with my pen light, and I want you to follow it, trying to keep your eyes on the pen. All right, here we go. All right, good deal. I'm gonna go ahead and dim these lights. I'm gonna look into your eyes. Just look straight ahead. Good deal. All right, and at this time, I'll be using ophthalmoscope to visualize the back of the eye. Okay, next we're gonna move on to your ears. Ears are symmetrical. There's a single piercing bilaterally. There's no lesions. They're warm. They have good elastic rebound. All right. I'm going to test for some tenderness over the auricle, the tragus, and the mastoid. Any tenderness there? Okay, good. I'm going to look in your ears. No cerumen noted. gonna have you close one ear. I'm gonna stand behind you. I'm gonna whisper a word. I want you to tell me what that word is. I'm gonna start on this side. Close your left ear.
Football. Baseball.
Okay, good deal. All right, the acoustic nerve is intact. And so next we're gonna go, move on to your nose. I'm gonna let me know if there's any tenderness. We're gonna palpate over the sinuses. Okay, there's no tenderness with the sinuses. The nose is midline. This time I'm gonna have you close one nostril and take a brief sniff in. All right, and the other side. All right, the nares are patent, and at this time I would test the olfactory nerve by using 3 distinct smells like coffee, orange, or mint, and have the patient distinguish between the 3. Next we're gonna move into the mouth, and I'm going to inspect your mouth with my light and a tongue blade, so just so you know what I'm doing. Let's start with the lips. They're symmetrical. Dry, there's no lesions noted. They're pink. I'm gonna have you open. Okay, it's pink, moist. There's no lesions. I'm gonna use my tongue blade just to open. Gums are good. Teeth are intact. They're white. No excess or no appliances noted. Okay, I'm gonna have you stick your tongue out a little bit and say ah. All right, and test your gag reflex. Okay. Sorry. And I'm gonna have you swallow. No, you're fine. And that's testing the glossopharyngeal nerve and the hypoglossal nerve. The hypoglossal nerve, we're going to have you stick your tongue out. Can you stick your tongue out for me? Perfect. Okay, so the hypoglossal, the vagus, and the glossopharyngeal nerves are all intact. Okay, so moving on. We're going to look at your neck. And, okay, so the skin is the same color as her face. There's no scars, no lesions. Everything looks good. All right, I'm going to have you turn from side to side. And go up and down, all the way up and all the way down to your chest. Okay, so now I'm gonna have you push against my hand. Good. We're gonna go this way. Good. All right, come down. All right, and come up. Okay, and that's the spinal accessory nerve. That's number 11. It's intact as well. Okay, so now we're gonna do it for your lymph nodes. Let me know if you have any tenderness. There's no swelling there, so that's good. Lymph nodes are good. No edema. And we're going to feel your carotid artery on the right. And then we're going to go to the left. And now I'm going to listen to it with my stethoscope. Hold your breath. Breathe. All right, so she has a good, strong, regular pulse without bruise. And next we're gonna go to your chest, and I'm gonna have you scoot to the end of this bed. I'm gonna look at your back. All right, so she has a AP diameter of 1 to 2. I'm gonna pull your hair to the side. Her skin is warm and dry, and I'm gonna feel her spine. Okay, it's straight without any bumps or anything, and we're gonna percuss the lungs. that's good. Now we're going to listen to your back in 6 areas. Okay, big deep breath. Big breath. Okay, one more. Okay, one more. Good deal. And then we're gonna come to the other side. Okay, so lungs are clear. There's no adventitious sounds or anything. So we're gonna come up and test your skin turgor on your chest here. Okay. There's no tinting noted to her skin turgor. Okay, you can have a scoot back now. All right, the next, I would go to the breast, and at this time I would assess her skin to make sure that it was normal with the rest of the thorax, that there was no vascularity, striae, or lesions. Nipples would be darker and everted. Breasts would be symmetrical, no masses dimpling. Would have her change positions 3 different times, and assess for the changes in the appearance of the breast. I would palpate the axillary nodes, and those would be this lateral, the central, the anterior, and the posterior. And then I would palpate the breast using a circular motion, cover the entire breast, and I would squeeze the nipples to check for discharge. After assessing those, we would say that she had no axillary nodes palpable, no masses, tenderness, or nipple discharge. And then I would move on, and I would start with her assessing her heart, and we're going to assess at a few different places. The first being the pulmonic, which is at the 2nd intercostal space of the right sternal border, and then we're going to go to the aortic, which is aortic is on the right side at the 2nd intercostal space. Then we're going to go to the pulmonic, which is at the 2nd intercostal space at the left sternal border. And then we're going to go to herbs, which is at the 3rd intercostal space at the left sternal border. And then we're going to go to the tricuspid, which is at the 5th intercostal space at the left sternal border, and then the mitral, which is the 5th intercostal space at the midclavicular line. So now I'm going to auscultate with my diaphragm and my bell. Okay. Okay. Heart sounds good. It's a regular rate rhythm. No adventitious sounds, no extra beats or anything. So we're going to go down and do your arms, hands, legs, and feet now. Skin is normal. It is dry. It is warm to touch. Feel your brachial pulses on each side. Brachial pulses are 2+ regular rate and rhythm. The radial pulses are 2+ with a regular rate and rhythm. I'll have you uncross your legs. There you go. Posterior tibial pulses are 2+ with a regular rate and rhythm. And the dorsalis pedis pulses are 2+ with a regular rate and rhythm. Now I'm going to test your capillary refill. Okay. Less than 3 seconds on the hands. And less than 3 seconds on the feet. And I'm going to check for any swelling. Okay. No swelling noted, so there's no edema to the lower extremities. And that concludes my physical assessment.